Hi everybody, today I'm going to be reviewing how to do a head-to-toe assessment. The head-to-toe assessment is a really quick and easy way to assess your patient. It takes about 10 minutes, give or take, and it can be done either when there's been a change of status in your patient, when you're getting a new admission on the floor, or when you're having a change of shift report and you're getting a new patient. Either way, it goes through the entire body and hits some key points that can help you to determine the status of your patient. With a head-to-toe assessment, it can be kind of hard to demonstrate on a diagram, so I'm hoping this video just gives you some tips and tricks to take with you when you're either learning how to do it through a live demonstration or practicing a live demonstration. So for my review today, I have a diagram of the anterior or front of the body and the posterior or back of the body. More than likely, when you do this assessment, your patient will be in a bed, whether that be a nursing home bed, their home health bed, or a hospital bed. It's just the easiest way to assess. We're going to pretend that our patient is in the hospital in their hospital bed. My first tip to give to you to help remember everything that's involved in a head-to-toe assessment is to do it in the order of literally head to toe. There's not one correct way to do this. Everybody does it a little differently, and the more that you practice, the more that you'll get comfortable in your own pattern. But for me, just to help me remember all the different components, I start at the head, work my way down, and finish at the lower extremities and the toes. So, like I said, we're just going to pretend that our patient is in the hospital, laying down in their room, in their bed. First thing you would do, knock on the door, enter the room, and perform hand hygiene. If they had any contact precautions, droplet or airborne precautions, now would be the time to put on some personal protective equipment or PPE, whether that be a mask, gowns, or gloves. Now would be the time to do it. If you need to be gowned up, once you're all gowned up, you're going to walk into the room and introduce yourself to the patient, let them know that you're their nurse, and you'll be doing some assessments on them today. If there's any family in the room, go ahead and introduce yourself to them too. Ask how they are related to the patient, and go ahead and ask the patient if they would like their family to be in the room for the assessment. Sometimes the assessment can get a little personal. We may need to lift the gown to access certain areas, but if the patient's comfortable with them in the room, they can stay. If they're not, now would be a good time for them to get up and leave. Let them know it should be about 10 minutes. Either way, you're also going to want to provide privacy for the patient. Close the door if it's a single person room. If there's another patient in the room, go ahead and draw the dividing curtain. You want to provide as much privacy for the patient as possible. Once all of the introductions and privacy is done, now we want to identify our patient. I've added an ID band on our diagram, and you're going to ask them to identify their name and date of birth. And as you're doing that, we actually have a pulse right here on our wrist, on our thumb side, called the radial pulse. You can go ahead and assess that and test for pulse strength while you're reading their wristband and comparing it to what they tell you. It's a really sneaky way to get one of the head-to-toe assessment components done and out of the way. You have to remember, though, that you cannot assess a pulse with your thumb because your thumb has its own pulse in it. So what I like to do is just stick my pointer and middle finger right over that radial pulse on the wrist, on the thumb side, and feel it. It should be palpable, and you can also compare it to the other side too. After they've identified themselves, and hopefully you have the right patient, you're going to want them to state their allergies. More than likely, they will have an allergy band on, but if they don't, it's always a good idea to still ask if they have any allergies and have them state them to you. Sometimes the bands fall off or they just never get put on in the first place. If you're in a nursing home, they don't have allergy bands on. So it's always a good idea to ask regardless if you see the band or not. So once again, you're going to do patient identification, You're going to palpate that radial pulse, and you're going to ask about allergies. Just in those few beginning steps, you're able to assess a lot of different things. You're able to assess airway and breathing. Is the patient's airway open, and is the patient breathing? If the patient is talking to you, then yes, their airways are open, and yes, they are breathing. When you palpated the radial pulse, when you touched the skin, what did the skin feel like? What was the temperature? What does the color of the overall patient's skin look like? What was the pulse strength? Was it stronger on one side or the other? Was it not palpable at all? And lastly, level of consciousness and facial symmetry. Level of consciousness, was your patient alert-oriented times 3? Were they in and out of consciousness, or were they not conscious at all? Facial symmetry, while you're talking to them, are they smiling? Is their smile symmetrical? Is one side of the face drooping as opposed to the other? Things like that could indicate a previous or current stroke. So just in that beginning chunk, there's already 3 different things that we can assess through that. Once you've gotten that done, I like to assess vital signs. Before I get into my assessment, I like to do vitals so I have a baseline. Some people like to do vitals in the very beginning, in the middle, and at the end. Once again, that's all up to you. I like to do it before I start my actual hands-on assessment. We want to make sure that we remember our vital signs and our normals. Our normal blood pressure is 120/80. Anything above that is hypertension, and anything below that is hypotension. Our heart rate, 60 to 100 beats per minute. Anything above that is tachycardic. Anything below that is bradycardic. Our respirations, 12 to 20 breaths per minute. Anything below 12 is bradypnea, and anything above 20 is tachypnea. You're also going to assess O2 saturation and temperature. Another thing with blood pressure too is that if the patient has a limb alert band on, it would more than likely be a band just like these two in a pink color, and it would be on the side that should not be used for blood pressure. So if they have a limb alert band on, make sure you don't use that side that it's placed on. I always ask regardless if I see a band or not. Some people have a preference of one arm versus the other. I once had a patient that had a limb alert on both sides, so we took the blood pressure at the ankle and at the calf. So just because that they don't have a limb alert band on doesn't mean that they don't have a preference. So make sure you always ask. And you can take the blood pressure in other areas other than the arm as well. After you assess the vital signs and get your baseline, the next thing I like to do before I get hands-on is assess for pain. You would just simply ask the client, "Are you having any pain today?" If they said no, you could just move on and continue with your assessment. If they said yes, you would ask them on a scale from 1 to 10, how bad is your pain? 1 being not bad at all, 10 being worst pain you've felt. And ask them where the pain is located as well. I like to ask this before I get hands-on because if I go to an area where they're having pain and I don't know, and I'm a little bit too harsh on the area, I don't want to cause my patient any more pain than they're already having. So that's why I like to ask before I get hands-on. The next part of the assessment is situational. You may have it, you may not. If the patient had an IV, whether that be in the antecubital space or in the hand, you could also assess the IV site. You're going to be looking for things such as swelling, redness, and the temperature of the skin around the site. We want to make sure that it's not infected. Any tubes that are hooked up to the IV, we want to make sure that there's no air in the line. the tube is actually connected to the patient, so hopefully they're getting the medication that they need, and you want to make sure that the IV solution is the proper solution and it's flowing at the rate that is appropriate. Once again, you're not always going to have a patient with an IV site, but if they were, that's always a good thing to take a look at too. Once you've gotten all that done, it's now time to move down to the chest area. We've already done the head, so now it's time to move down to the chest. We're going to inspect for symmetry of movement. Is their chest moving symmetrical when they're breathing? We're going to ask them if they're having any chest pain or if they're having any shortness of breath or trouble with breathing. The next thing we're going to do is we're going to listen to their heart sounds. I have another video on this, but just a quick review. We're going to listen ape to man. Things like that. And then we're also going to listen to the lung sounds. We're going to listen anteriorly and posteriorly. You're going to have the patient take some deep breaths in and out. And I always like to tell the patient at any time you get lightheaded, let me know and we'll slow down, because sometimes taking some big breaths in and out can cause a patient to become lightheaded. Once again, you're going to inspect the chest. Look for any changes in skin around the chest. Going to make sure that it's symmetrically moving when they breathe. Ask about any chest pain or trouble breathing. Listen to the heart, and then listen to the lungs. Once we've done the head and the chest, now we're moving down to the abdomen. You're going to inspect first. You're going to look at the stomach. Look at the skin color on the stomach. Is there any contour, distension? Do they have any dressings or incisions or suture lines? Like, those things are situational. They might not always have that. But if they do, it's always a good thing to assess. After you inspect, the first thing you're going to do is auscultate. So take your stethoscope, and the abdomen is broken up into 4 quadrants, and listen for bowel sounds in all 4 quadrants. You want to make sure that bowel sounds are heard in all 4 quadrants. After you've listened to the bowel sounds, you're going to want to palpate the abdomen. You're going to palpate for any tenderness and firmness. If the patient is wincing, that could indicate that there's some tenderness there. You could ask them about their last bowel movement and their last void. When was the last time they urinated? And if they're having any trouble with either of those things, now would be a good time to assess that area. If there is an incision on the abdomen, we would use the acronym RITA. Which stands for redness, ecchymosis, edema, drainage, and approximation. That's just not for an incision on the abdomen, that's any incision. Just so you know. Once we've done the abdomen, we can move on to the lower and upper extremities. So basically, when you're looking at the extremities, we're looking at the arms and we're looking at the legs. You want to look for the skin color, skin temperature. Are they able to move their arms up and down? We already assessed those radial pulses, but if you forgot, you could always do that now too. Is there any edema? You would check for edema in the legs, in the lower extremities. You would also assess the pulses. We have a pulse down here, and we have a pulse right on the inner inside of the ankle. You could assess those pulses on both sides, make sure that they're palpable, note the strength of the pulses. The pulse on the top of the foot is the dorsalis pedis pulse, and the pulse on the inner ankle is the posterior tibialis pulse. You're going to want to make sure that those are palpable. Also check for skin integrity on the lower extremities. You want to check for skin temperature, skin color, things like that. And lastly, there's this little thing called skin turgor. It's basically looking for hydration of the skin, and we're looking for snapback. The best place to assess skin turgor is right at the clavicle. You basically just pinch right above the clavicle and let go. You want snapback to be fairly quickly. That indicates adequate hydration. On our elder patients, when we pinch, their skin kind of stays in that pinched form, and that just shows that their skin is a little bit more frail and maybe they're not as hydrated as we want. And overall, you can do this throughout your entire assessment. You want to be checking skin integrity. That's kind of done as you're doing everything else. When you're checking the face, look at the skin on the face. When you're inspecting the chest and the abdomen, look at the skin on both those areas. Look at the skin on the arms when you're checking the ID bands. When you're looking for edema and testing the pulses on the lower extremities, look at the skin. Things like that. We want to make sure that the skin is very important to assess, so we want to make sure that we are focusing on that too. So once again, overall last tips, try to start from head and finish at the toes. You're going to start at the head. Like I said, there's many different things that you can assess after your introduction. And then you move down to your chest. That's when you're going to listen to your heart and lung sounds. You move down to your abdomen. You inspect. You auscultate before you palpate, because if you touch before you listen, you could obstruct some bowel sounds. And you can also ask about bowel movements and voiding here. And then you move on to your extremities. What does the skin look like? What does the skin feel like? Can they push and resist against your hands? Do they have strength, motor reflexes? Do they have a blood clot? Things like that. Check for pulses, radial, and posterior tibialis and dorsalis pedis pulse, things like that. So, that is a quick review of how to do a head-to-toe assessment. Hopefully this helped clear some things up for you guys. Don't forget to like and subscribe.